how does SAN as a chatbot fit into this ecosystem and this new reality where cancer is part of everyday life? Like, what does SAN actually do, which is, let's call it, preferable to existing methods of dealing with quality of care for people who have cancer?
Sure. So today, the challenge we have is that while we focus on addressing cancer, and that's great, we want to do everything we can to save that patient's life and to support them. But we are really not able to bring the whole person into their care and be able to support them in all aspects of their health. Because as cancer clinicians, we are very, very busy when we are in the clinic, in the cancer center, and we have very limited time with the patient. At the same time, the care is moving more and more outpatient, which means that patients come in for their chemotherapy or radiation, and then they go back home and have to manage things on their own. What happens is that they are okay when they are with us, but once they go home, they're either afraid of bad things happening to them, or bad things actually do happen to them, and they end up in emergency department or having treatment disruptions, which hurt everybody in the ecosystem. So what we are doing essentially is, what if we could be that navigator, that nurse who is by the patient's side 24/7? What if your loved one, when they are going through cancer, had a 24/7 private nurse who was with her the whole time, supporting them throughout this process so that they can have the best outcomes possible? And that's what SAN is. SAN is literally a clinical replication of my knowledge and my experience as a cancer nurse. And she's there with the patient throughout this journey. So at the start of the journey, SAN is helping the patient and the family member with preparing for their treatment, helping to manage care coordination, referrals, education, and getting ready for what is to come. And then throughout the treatment, helping the patient and their family member to be able to have the best outcomes possible, to be able to stay on the flow and be able to manage all the symptoms that are expected as well as unexpected, support them on the emotional side as well as on any navigation, any community support that they need. And if the patient's condition starts to decline, if they start having problems, then let's find it quickly and then be able to connect them to clinicians who can help to address it so that they don't end up in emergency department or having poor outcomes or disruption in the treatment, because none of us want that. We are rooting for the patient to have the best outcome possible, for my loved one to have the best outcome possible. So that's what SAN is doing. She's staying throughout the patient journey with the patient, supporting them. It's a real-time chatbot. So she's able to handle over 300 to 500 different symptoms as well as hundreds of navigation needs for the patient.